back to education as your #1 priority, Delaine. So let me ask you, you talked about California being among the last in the nation in per pupil spending. What is your plan to bring up those spending levels?
Well, we were 5th of the 50 states, and now we're 41st of the 50 states in per pupil spending. So if budgets are statements of values, we have to get our values straight. The reality is that we're #1 in per prisoner expenditure in the nation. So my attitude is you look at the budget the way a family looks at its budget, and you make the decisions based on what's the best for the children, because the Constitution of our state actually says that children's education should come first. And so that should be universal preschool, it should be more child development, it should be K-12, and it should be higher ed. We should make college tuition free again. And we should do all that, and we need to, in fact, take a good look at Prop 13 as it applies to commercial and industrial properties to get the resources into the system to do what we need to do for our children. In a global economy, education isn't less important than it used to be, it's more important, but we're acting like we think it's less important. I don't understand.
Well, just to be clear, Proposition 13, of course, passed by the voters back in 1978, I believe. You would have to go back to the ballot. Do you think that that's a winnable fight?
I do. If you go back to the ballot and you say, we're not going to increase homes, we're not going to touch people's homes, homeowners are actually paying a bigger percentage than they were back in '78, and the idea was to help them. But they're paying much more now than they used to because commercial and industrial properties never get reassessed unless they change hands. But there were those who said, well, when 50% of the stock turns over, it'll be reassessed. No, that hasn't happened. And so you have really very valuable pieces of property that are being taxed at the level they were taxed in 1978. And that's hurting local schools, it's hurting local communities. If you go to the voters and you say, we're going to commit to spend this money locally, mostly on education, but also on some other aspects of local improvement, then I think the voters will say yes. You only need a 50% plus one vote to get the voters to change that statewide. But the Prop 13 says you have to get a 2/3 vote to raise any taxes in terms of property. So each district has to get that. So by going back to the voters and saying, let's make this one correction, let's reassess commercial industrial properties every 10 years, maybe increase from 1% to 1.5% what they pay, you will have a wonderful opportunity to help the kids and to do a lot of other things.
Delaine, single-payer health care has sort of risen to be the topic in this governor's race. Could you talk a little bit about what your plan is? You support it, I understand?
Yes, I support it. I think health care should be a right, not a privilege of the wealthy. And I do know people that have had bankruptcies and have had their lives ruined because they had some very expensive health problem and they didn't have insurance. And people make bad decisions. There was a little child brought into the emergency room in a hospital, and the doctor and all worked all night to save his life. He went deaf in 1 year. He cost the taxpayers over $50,000, all for want of $4 worth of antibiotics. So we have to understand that the preventative care is what they do in the rest of the first world. Whether you go to Canada or whether you go to Europe, they're spending less money and they have better health care. And that's what happens when you give everybody the promise and realize the promise of real health care for all.
But wouldn't we have to give up or change Medicare to accomplish what you're trying to do? And would that even be allowed?
Well, we might modify it, but not to reduce it in any way, to make sure that everybody had Medicare, to make it Medicare for all. I mean, everybody who loves Medicare should think, well, why wouldn't I want my grandchild to have that same right that I have right now?
Why do you think government would necessarily be more effective or more efficient at delivering health care than the private sector?
Well, I mean, let's face it, the private sector is in some cases very efficient and in some cases is not very efficient. If you look at that little boy who needed $4 worth of antibiotics and didn't get it and it cost the taxpayers $50,000, you know, it really is important that we understand that there are certain drugs, for example, where we see a 300-fold increase in price because, in fact, they could do it. And so it shouldn't just be about the profits. It should be about the health of the people who live in California, the health and safety of our children, of our seniors, and everybody in between. And I really believe that we have the best medicine money can buy, but if you don't have any money to buy it, you can die.
You and Gavin Newsom, among the Democrats on the ticket, have basically made the point that a lot of the money that would be required for single payer is on the table in different ways. As Lois pointed out, it would require some waivers. However, two of your other Democratic opponents, Antonio Villaraigosa and John Chung, have withheld support for single payer, saying you need a plan. The money still does not add up. And the legislative analysts talked about a pretty big price tag. Where would you raise that money to make up for that gap?
Well, I do think it's a big challenge, and California, though, has met the challenges in the past. We built the finest public university system and college system the world has ever seen. When we first started it, there were people that were questioning us. And so you have to dream big to do big. And I just think when you look at the money that is on the table, which is all of the public employees today who are insured, as well as the retirees of the public system, as well as Medicare and Medicaid, there is money on the table right now. There is some additional money required, and you could probably do a gross receipts tax to raise that money. But everybody wants to talk about the cost. And, an ounce of prevention is worth a pound of cure. If we could, in fact, have fewer people in emergency rooms, have fewer people with life-threatening illnesses because we forestalled them getting care, we would, in fact, see some savings. Canada spends a lot less per person than we do, and they have much better health care. And we have a population that at least is somewhat similar to Canada's in scale.
You were talking earlier about water storage, that you were despairing the fact that it rained so much last year and yet we didn't capture that water for our use. Would you be building more dams? What would you be encouraging to address that?
It'd be a multifaceted approach, but first we need a long-range water plan. The last water plan was done in 1957. Pat Brown was the governor of California. And look at us. We make every city and every county do long-range planning, and then the state isn't doing it. And it's not just in water. There's a whole host of areas where we don't have a long-range plan. So I would start certainly with water, because last year there was a record rainfall and the water ran into the ocean. So we need to have a plan for capturing water, for storing water, and it doesn't necessarily mean a bunch of new reservoirs. It means that you can inject some of it into the aquifers, you can use it more fastidiously when you use it, you can reuse some water, and that's what they do absolutely in certain quarters of California. There are individuals showing how much they can save. But if you go to Israel, you go to many of the desert countries, you'll see that they capture a lot of water that has been used and reuse it. There's a lot more that California could do without having necessarily to just say we have to build a bunch of new dams and we have to, ration water. I mean, we can and should have a long-range plan for water, but we should have it in a lot of other areas as well. And it should include things like maintenance of Oroville Dam, because that's a big expense because we weren't minding our store.
Would you continue the governor's plans for the tunnels to ship water around the Delta? You live in Davis, so that's kind of right in your own backyard.
No, in graduate school at UC Santa Barbara, I joined Save San Francisco Bay Association. I've been a member ever since. I would never build those tunnels. They're the peripheral canal with a lid on them. And the voters voted them down overwhelmingly. So I believe that they are not in the best interest of our long-range health of the Delta and the Bay. And I think it's really a foolish project, and I would oppose it. I think there's far better ways that we could get more water for less money.
Homelessness, of course, is a pervasive and very difficult problem here in San Francisco, but we're also seeing it throughout the state. Los Angeles, by order of magnitude, has a much greater problem. You mentioned you even see homelessness in your hometown of Davis. What will your homeless plan look like?
Well, first there has to be a short-term plan for urgent care for people that are on the streets, that are women and children, that are seniors. People with mental health issues need to get mental health support. So we need to do some vouchers for hotels and motels. We may need to build some tiny homes. We have to, though, have a much bigger conversation about housing in general, because way too many people are marginally housed right now. We've got, I know a guy whose wife and 2 kids were evicted from their apartment, and they literally are rebuilding the mother's garage so that the family can live there, because they can't afford to live in the East Bay, in Walnut Creek. And so what we have the oldest children living at home with their parents of any state in the union. And we have a whole host of people that are couch surfing or living in cars or in vans. That just isn't acceptable. It's our college students as well as our families where maybe the woman has been abused by her husband and just ran out the door with the kids. So we have to do short-term planning and then long-term planning, where we build more housing. And we need to build more housing next to transportation hubs so that people can walk out their front door, go around the corner, and get on the BART train. And that's what we did in Union City. We built hundreds of affordable and market rate housing units that were multi-story near the BART station, and the people love it. Their kids walk 2 blocks to high school, 3 blocks to elementary school. They can walk downtown to shop, and they can get on the BART train without moving their cars.
Delaine Eastin, thank you so much for joining us.
I'm honored to be here with both of
I
you.
also want to thank my colleague Lois Kazikoff, and as well as the executive producer Spencer Whitney, and thank all of you for joining us this afternoon for this edition of Opinion Central.